Ladies and gentlemen, welcome to the seventh episode of Endocast. Our topic today will be to see or not to see. As usual, the podcast will be hosted by Ahmed Shoki. Hi, Ahmed.
Hi, Francesca, my co host, always, Francesca Cerutti. I think we all agree that in dentistry in general and in endodontics in particular, being able to see what we are doing just give us an increase and a boost in the quality and precision of our work.
Yeah, I totally agree with you. I would not even be able to think about working without magnification nowadays. But the fact is, which kind of magnification do we need? I'm sure that people attending to your courses and workshops often ask you this question.
Yeah, that's happened a lot. The big match, the big questions is between magnifying loupes and microscopes. Both solutions have advantages and disadvantages, and the literature, unfortunately, don't give us a lot about that issue.
Yeah, I searched for it recently, and what I found was not reassuring. The Cochrane review by Del Fabre and colleagues says that there is no evidence on this topic and that the clinician should choose the tool based on one's experience.
Yes, but on the other hand, we have articles also proving that using microscopes in our practice increase the accuracy of motions. I'm speaking about the motor function of the clinician, even if the clinician is not that experienced. The flip side of the coin is that there is a learning curve, and the operative time somehow increases in the beginning, especially.
Yeah, true that. I perfectly remember my training with the microscope. But when we think about endodontics, we have a position statement of the American Association of Endodontists that suggests in which phases of the treatment microscope is strongly recommended. They don't say you can do it without the microscope, but they see, okay, you're doing it better if you see better.
Yeah, so the point is, do we always need a microscope? If not, when do we absolutely need it? In which part of the treatment?
So we decided to get help from a friend, which is Dr. Garima Poddar. She's a silver member of Style Italiano Endodontics. And welcome, Garima. What can you tell us about magnification in endodontics?
Hello, Francesca, and hi, Dr. Ahmed. It's a pleasure to be, on Endocast. I follow all your episodes, and it's awesome. Magnification is one topic which I really love because I feel that it has been a boon in my endo practice as a clinician. So let's explore a little about it. Now, first and foremost, magnification in endodontics. As Dr. Francesca rightly mentioned, that is it like essential? Can we do without it or not? So, yes, we have different articles supporting it, which suggest that yes, microscope and magnification, let's say it could be a microscope or loupes, are definitely a boon and they enhance the practice value. Now, definitely, there are so many PubMed index articles. They would suggest that using a dental operating microscope, it is definitely really helpful in multiple procedures in endo. So, what are the benefits about it? So, there are lots of benefits which we can, obtain when we are using a source of magnification, and particularly when we are using a microscope. Because with magnification, we get coaxial lighting, we get unobstructed vision, the illumination which we derive through a microscope is unmatched. And definitely, when we want to do a non-surgical or a surgical procedure, we want to do an instrument retrieval, or I want to look for an extra canal, we can definitely have a better vision. We can use smaller instruments, and so the trauma which we induce during a procedure would be really less. We can be less aggressive and more conservative in our practice. So definitely, in my opinion, magnification is my go-to tool for any endo procedure.
I definitely totally agree with you, Garima, about what you mentioned about the microscope and the use of magnification in general. But let's take it from the very beginning, and let's talk about the difference between the microscope and the magnifying loops. What do you suggest about that?
Oh, that's a very nice question, Ahmed. So I feel that, there are some of the benefits which one can get from loops, but if you look at the larger picture, let me just try to explain both loop and microscope a little bit in this time frame. So when I talk about loops, now loops are definitely more compact, less expensive, and definitely if you have like a multi-chair practice, or you want to be like operating or consulting at different operatories, then definitely loop is a good option. But then when I talk about ergonomic, being a dentist, we are totally compromising our posture. So microscope provides us with a perfect neutral body posture, while on the other hand, with loops, there would be posture correction as compared to when we are not using, any sort of magnification. But still, we have to, have a little angle of declination, and as a result of which, my neck would always be, looking down. So, from ergonomic point of view, definitely microscope is the best. Now, let us explore the level of magnification. When I talk about the level of magnification, with lens, with loops, the magnification is a bit limited. So we can have like from 2.5x up till 8x. While with microscope, we have a very higher range. So we can go up till 30x with microscopes. So definitely, if I want to explore a broken fragment of instrument deep inside the canal, so for all those things, my go-to tool would be a microscope. Now, talking about the optics, like how a loop works versus how a microscope works. So with loops, we have a different physics which is totally applied. So there are convergent lines of sight leading to eye strain over a longer duration of time. But with microscope, because it has a parallel line of sight, it allows more relaxed eye muscles. I am not saying that we cannot do each and every procedure, without a microscope, but I definitely feel much more comfortable in endodontics when I'm using a microscope.
Yeah, it's extremely clear, Garima. Thank you for explaining. Let's assume we have a microscope. When should we use it in endodontics?
So in endo, I feel that starting from the access cavity preparation itself, magnification should be used. Why? Because I want to be conservative in my access preparation. So when I can see very clearly, I would be able to conserve a part of dentine which I might not be able to conserve when I'm not using any source of magnification. Then let's say I've done an access preparation and I want to refine the walls. Everything is so crystal clear when I'm using magnification. I and then when let's say I want to explore the floor of the access preparation, then in those cases either loop or a microscope would definitely be more helpful if I have like bulk stones in the chamber. Or let's say I want to explore that extra MB2. Now, when if it is an extra canal, or it is let's say a very calcified canals, in all those cases microscope would be more beneficial because of the level of magnification it provides.
Yes, that was very clear also. But let's go also, because many clinicians will listen to that podcast about the magnification. We know that the learning curve is a problem when dealing with a magnification, whether a magnifying loop or a microscope. So, what's your advice for the clinician who are introducing magnification in their practice, just to get easy with the learning curve in the beginning of using the magnification? What's your advice for them?
So, in general, in the beginning of one's phase of, using a source of magnification, definitely my advice would be that you should go for, any colleague who is aspiring to start with magnification. First and foremost, learn about it. You could go for, some of the educational programs. And the idea is that, when I'm making an access preparation, my bird should I should understand where my bird is going, etc. So I have to train my mind, and we have to get in sync with the working with a source of magnification. So I personally feel that with easier cases one could start using magnification, but definitely if we start using it with some basic training, it is always better.
Okay. And once opened the access cavity, we have to identify the anatomy. And here the literature is very clear and says that our chances to see the root canal openings, even in particular anatomies, are significantly higher with a microscope. So there is no doubt about it. But I know you wanted to share with us a clinical case that was particularly tricky and that you solved with the microscope.
Oh, yes. Francesca, I would like to share one of my cases where I feel that, using magnification in that particular case was definitely a boon. So it was a case of tooth number 44, that is right mandibular first premolar. And this patient had, a severely treated tooth, which resulted in exposure, and it was tender on percussion. Now, when I looked at the radiograph of this particular tooth, I realized that it definitely looks like a different aberrant anatomy case. I could understand that yes, there are multiple splits in that particular case, but with multiple different angular radiographs, I could understand that yes, probably it is like a 4-4 anatomy. But then, a slender premolar, and then we have to search for, let's say, 4 canals. So I wanted my preparation to be precise. It should neither be too aggressive that I end up, compromising entire tooth structure of that premolar, but at the same time, I do not want to miss the canals. So in this particular case, I worked under magnification, under a microscope, and I was working under 25x magnification. And if you could look at the screen, there were two buccal canals and there were two lingual canals. So I tried my level best to be as precise with my access preparation, such that I would reveal the canal orifices properly with straight line of access, but at the same time do not drill more than what is required. So, in this particular case, we found a 4-4 anatomy, and there were two roots in this premolar, and each root was housing two canals each. So, imagine a premolar, which is already a very slim, slender tooth, not very bulky, and it is having two different roots, and each root is housing two canals. So in totality, I felt that I have to be able to do irrigation properly. I have to be able to do justice to my obturation and everything, and I feel that microscope was the reason I could do a precise treatment for this particular case. We did a warm vertical compaction technique of obturation also, and everything was under a microscope. And I feel that right from not missing out on a canal to being precise when I'm shaping and looking through the microscope was indeed helpful in that case.
Thanks for that, case, and I really know that case from before, Garima, and it really shows how the microscope helps us in controlling the procedure. So, but there is another aspect in which the microscope is a winner over the magnifying loops, which is the identification of anatomy in calcified teeth, which is for me is a nightmare. Uh, um, and not only that, but also helping in diagnosis of very difficult clinical situations like cracks or cracked teeth. So, what's your input about that?
Oh, yes, definitely, Ahmed. When it comes to calcified canals, it is definitely a nightmare for any clinician, including me. And trust me, with the magnification, I find it pretty easy as compared to when I'm using, I used to work previously, let's say a decade back, without magnification. So, what is the benefit what I get when I'm using magnification during exploring calcified canals? So, I think there are two things. One, with magnification, since we can magnify and see the floor so clearly, definitely we can observe and explore the minutest parts very clearly as compared to when we're doing it with naked eyes. The second thing, along with magnification, I think the real boon, which is illumination. And illumination, I feel, with good lighting, it provides us, immense clarity of the chamber, and it becomes really easy to find that minute, canal opening which could be there. So, with the help of a DG16 probe or with ultrasonic tips, if I'm troughing and at the same time I'm visualizing that under a microscope, I would be able to locate the canal orifice most of the times. So I feel that definitely with calcified canals, once I have explored and I've found and located that canal, it becomes really easy to go forward. Now, talking about cracks. I feel that cracks could be sometimes identified without a magnification tool. Also, let's say I might be using a methylene blue dye, and I could find a crack. But when I'm using magnification and I'm using good illumination, it definitely becomes very clear to rule out cracks. Sometimes, clinically, while working, we come across micro cracks which might have, not been diagnosed on a radiograph, or let's say I could not diagnose it clinically earlier. So, for me, even for crack identification, I think my go to tool is a microscope. And these days, with a lot of microscopes, there are a lot of contrast and different types of light settings which are available, which further help in identifying cracks in a particular tooth.
So, Garima, now we found the root canals, we shaped, and we cleaned. Do you think we need microscope when filling?
Definitely, Francesca. At each and every step of root canal treatment, when I can see through the canal and I can have a direct vision inside, let's say, of the canal, it becomes really helpful. So, if there is a perforation, for example, or let's say it's a widened apex, and I want to do an apical plug formation using MTA, in all those cases, I've seen my cases becoming more precise, and the workflow is smooth, and when I'm using a microscope, so I get a direct vision of the canal, and I can definitely see where my MTA is going, how much is going, whether I'm compacting it properly or not. And then, of course, we can verify the same with radiographs simultaneously. But when using a material like MTA or a putty or whatever, we all know that we have to be swift with our treatment. So the workflow with a microscope is so nice that these procedures become really really easy.
So now we come to the hot topic that we discussed in all the 6 episodes before, which is the real nightmare for a lot of endodontists. the separated instruments. Um, how can the microscope help us in managing this situation? Because we need to clearly see what we are doing when we're dealing with the separated instruments regarding a lot of aspects. So, can you elaborate on that, Garima?
Oh, sure, Ahmed. See, I definitely feel that retrieval of instrument is one thing where I feel that microscope is definitely mandatory, because we could do a bypass of an instrument without magnification also, but when it comes to retrieval, I definitely want more vision inside the canal. Now, because the concept of retrieval is such that we have to be able to see the head of the instrument, and then only we would be able to use an instrument retrieval tool and grab that instrument and pull it out. So, not only for that, whenever we are using a technique where we are staging or we want to try to clear around the instrument, the crux is that we have to have a clear vision. If I can see the instrument fragment inside the canal, then only I would be able to retrieve it. And for that, definitely there are certain limitations. With a microscope also, I want a straight line of access. So if I can have my instrument is separated at a level where I would be able to have a vision through my microscope and I would be able to see the head of the instrument, then only I would be able to retrieve it. Let's say the instrument fragment is broken beyond the curvature of the canal, where when I see through my microscope and I'm not able to have a good view, then probably I might not be able to retrieve in that particular scenario. So definitely, sometimes microscope could not be like 100% answer to a particular situation, but when it comes to removal or retrieval of separated instruments, I think microscope is a must.
I agree. And I also think that the microscope is great also to do a final check of our job before the post and the restoration, to see, for example, if we clean correctly the cavity or we removed all the sealer, etc. Am I forgetting something, Garima?
I think we have covered almost everything, but yes, one more thing is documentation. Like Francesca, I feel with microscope, a camera, a good camera attached to a microscope, it definitely makes our documentation quicker, more elaborate. We can capture each and every step in images or in video formats, and the quality is really good. So, it has two fold benefits, not only as an educator, but even if you want to show it to your patients, it is a practice builder. You can actually make them understand the kind of work we are doing, what exactly we did. Even for something aesthetic procedures, also sometimes I feel documentation is a must, and definitely for our lectures, for showing it to our colleagues, for everything, it is a great tool.
I definitely agree about that in terms of the documentation, and I have to add that regarding the medical legal aspects, we need to have a lot of documentations because we, as endodontists, we are dealing with problems referred from other colleagues. So we need to just document our cases, and not only that, we learn from our previous work. So documentation will help us also to improve ourselves. That's a hidden gem in documentation by the microscope. Um, um, that was all about the non-surgical part. We just deal non-surgically. What about the surgical job? I would not even start an apical microsurgery without a microscope. It's called apical microsurgery. So I want to be a lot conservative in all terms in that job. So the advantages are too many, right?
Yeah, definitely, Ahmed. Even I would not dare doing, a microapical surgery, as you rightly mentioned, without a microscope. So, what are the benefits when we're using a microscope for surgical options. Okay, so one, first and foremost, I feel that for soft tissue management, it is excellent. Now, when we're doing soft tissue management, we would want to use very fine suture materials. In those cases, also being able to visualize better. If I'm able to magnify and see each and every layer of what we are doing, and I would be able to use my very fine size instruments to grab those sutures and to grab the fragment of skin or mucosa or whatever. So definitely for soft tissue management, it is my go-to tool. For all the surgical procedures like an apicectomy, definitely microscope is a great boon. You would be able to visualize each and every aspect so clearly. So definitely it makes our job precise, least traumatic for the patient, and definitely the workflow is improved. And if someone wants to do an intentional replantation or a procedure like that also, it definitely comes in handy. So I feel that so for surgical endodontics, microscope is definitely a great tool.
Well, I think we gave overview of this topic.
Yeah, I agree with that, and I really thank Garima for her presence today with us. Thank you, Garima, for sharing your knowledge with us. And magnification is a must. Whether a loop or a microscope, we should start with it in our daily practice. It will improve our work. It will help us to get better. Thank you, Garima, for sharing your knowledge with us.
Thank you so much for inviting me, and I think you guys rock, and I'm so glad that I could be here and share some thoughts with you and Francesca. Thank you so much, both of you.
Thank you, Garima, and thanks everyone for watching us. So stay tuned for the next episode of Endocast.